if I'm 20, how do I live until I'm 120?
Okay. All right. But can I ask you back to question first? How do you see yourself when you were at 120?
How do I see life?
Yes.
I think, well, what comes to mind instantly is I can't function in my body nearly as well. I'm sat kind of in a chair. I might struggle walking, and I'm sort of slower. I probably can't hear. I've got like a hearing aid, and it's taken me sort of longer to think and process. What about you, Joel?
Well, I think, okay, maybe you've gone for the sort of maybe harsh reality of what that might look like, but I'm going to go with the optimistic perspective of if I could, have a reality of living to 120, what would I want that to look like? And for me, it's more about, I would like to still be cognitively present in my life. I don't mind if I'm not physically mobile. I don't mind if I can't do things, but I would still like to be able to interact with people I love in the same way I can now. I'd still like to be spiritually present and not losing my sense of self and my sense of where I am and who I am. So I'd like to keep the mental side more than sort of the physical side for me.
I see. And what is the purpose of you trying to live up to 120 years old? Whether you live to see some big change in life or in the world?
I think the thing is you only live once, and I wouldn't see why you wouldn't want to live as long as possible. I think like it would be nice to see how things evolve for another 40 years. I feel like when I get to 80, I'm not going to really want it to stop. I'm just going to want to sort of keep going and just keep watching the world and keep experiencing the joys of life.
I see.
And I guess I have a different opinion to that, where I'm like, I don't mind if my life isn't, if I don't reach 100 or don't reach 95 plus or whatever. I just like to in the time that I do have, try and maximize the quality of experience that I can have and the amount of sort of love I can express to those around me and the impact I can have. And so I don't fear death, I guess. I don't see it as necessarily a bad thing, but that's because of my like spiritual or more religious philosophies and views.
I see. All right. Thank you very much for this lovely question. I think this is a very good question for us to really ponder on and see what we can do about it. So why did I ask you these two questions? Is like, number one, how do you see yourself at 120 years old? And why do you want to live until that age, you see? So first of all, it's because many people will think like living longer is good, but doesn't mean that you have a very good health span. So what you mentioned just now, living to 120 is about lifespan, how much you can reach, how far you can reach. But it's about depth of your life rather than the length of your life. If you see it that way, that's how I see it as well. So when it comes to health, it's the same. It's not about the lifespan, the length, how much you can reach, but it's about the health spans. That means like Joel, what you mentioned is that I don't mind to live a shorter life, but if I can live it to the max of my life, that's all that matters. So it's also the same when I try to approach my patients or any of my clients having the thought saying that they want to live as long as they want. Then I will try to make sure that let's live to the fullest first every single day before we try to push an extra mile. So that's what we are aiming for. So if you ask me, I would first say, if let's say you want to live up to 120 years, so we must first make sure that the next coming 1 year, 2 years, or even about 10, 20 years is going to be at your healthiest, most state of life. So to do this, as a functional medicine doctor, we always go back to the basic foundation. There's only 5 main pillars in life that we focus on. Stress and relaxation, how you manage your stress. Second is about how you sleep well. The next one is about your nutrition. And the other one is about your relationship with other people, which I believe this is more or less been ignored sometimes, especially when it comes to young people these days. They are very obsessed with their phone. They are very engaged on social media, but when it comes to real life relationship with people around them, this is something that we really have to talk about and try to cultivate a good culture where they build a good relationship. You will tend to see that centenarians, anyone who live until 100 years old, they have a good social cycle. You notice all of them will have a good social cycle, even they are at 100 years old. You will rarely see someone who live until 100 years old, but they are all alone and they don't have friends around them. They don't have any support around them. And one last thing is about exercise. So this is the 5 main pillars in life in functional medicines that we will focus on. And if you can do well in each aspect, I believe that you'll be able to live regardless of how many years old, but you will be able to live to your fullest every single day.
Thank you. That was a really nice answer. Like really coherent, and like it ended with a nice sort of five point structure for us to kind of work with now. Do you find when you're working with people, this is just a question I'm interested about, do you focus on like slowly up leveling each of those 5 at the same time, or do you focus on one in particular for them to get right and sort of build that habit and then move on to another one? I mean, what's your kind of process for me and Jacob and the people listening of like, if we want to improve these 5 pillars, how would you go about doing that?
In fact, I will go on to all 5 perspectives of this rather than doing one after another, because I believe that you sleep every day, you should be exercising every day, you should be having a good relationship every day, you should be having a good exercise every day, and also you should be managing your stress every day. So I suppose this is meant to be done all in one shot, but of course we can choose to do bit by bit in each single aspect. Meaning that, let's say if I want to try to build a good relationship, I won't ask you to have 10, 20 friends in a day. I will ask you to, why don't you start building a relationship with anyone closest to you first? Then we go superficial in each pillar, but we start all at the same time and slowly go in depth to all together. That's how I see it.
And if we apply these 5 principles, can anyone, in theory, live past 100 and decide to be Brian Johnson if they want to?
I believe, yes. Actually, yes. Yes, this is very important. So Brian Johnson does a little bit extra miles when it comes to all of these 5 pillars, actually, using a little bit more when it's talking about biohacking and also nutrition. So instead of just the plain diet, he tried to focus a lot more on supplementations. So this is the depth, how much he has gone, you see. So it is still the right way to do, but how deep and how far you want to go, that's another.
Doesn't Brian Johnson have like 80 pills in the morning or something?
Yep. I think he has recently simplified it. It was all started with 100 plus pills and now has gone down to 80 pills or maybe even lesser with all his blueprint cocktails. But yes, that's the idea of how certain people will consider supplementing them. Don't do it blindly. He has a team of people who can track him and know how much is he's taking and see how his body responds towards all these supplementations. So as long as you're not doing it blindly, yes, you can definitely supplement it accordingly to your own health condition.
I guess he's an extremist that's going like beyond the line in something to give the normal person a like bit of a kick to do the basics to improve their health and their well-being and their health span. It's like you see the example of, wow, this is possible. This guy's trying to do this thing. But wouldn't it be amazing if I did these small little changes that could, add another 10 years of healthy life onto my experience? One thing I'd like to ask you, just so there's sort of some practical takeaway for me and Jacob and the people listening, as I said, is there maybe one like biggest mover tip in terms of changing our behavior that we can do to improve these 5 pillars? Could you give me one thing that maybe you suggest to your patients or to people in your content online and stuff to improve each of these 5?
I suppose if you say doing any change in your life, it comes to the determination. So how determined you are to decide to change, or even making small movements in each single pillars. So determination is pretty hard, turns out, when I deal with a lot of patients every single day. And for someone who have been having a bad habit, for example, sleeping late every single night, if you ask them to sleep early, they will have a big struggle trying to do this. Regardless of any pillar that we are trying to work on, it comes down to how determined you are to do this. And determinations normally will only kick in when somebody has suffered through certain things. So they got certain impact in their life, especially when it comes to health. They got very sick themselves. They are sick of living that kind of life. Then they decide to change. And once you have the determination, any change would be quite easy for you. Yes, to me, it's definitely the determination.
I really like that, Jake. Can I just jump in and say this because I've made a couple of notes here? I really like that point because you didn't just tell me like the things that you can hear in any wellness advice piece of content. You know what I mean? About like eating more whole foods or getting good sleep hygiene or, you know, getting you into certain levels of cardiorespiratory like activation during exercise and stuff like that. No, you talked about determination, and I wrote here, it seems to be that's like the antidote to resistance to change, because we're, as human beings, we're in love with just what you already do, don't we? We love the certainty. We love the status quo. We don't like making changes in our life, even if they're changes that benefit us. It's this weird thing about the mind, and that idea that we need to suffer to notice we need to change. Because I guess with health stuff, like you said, it's all a combination of these small things we do every day. Like, what time do you go to sleep, and what do you do before you go to sleep? What does your breakfast look like? Like, how do you treat your partner when they come home from work? How's your relationship with your kids or your friends? Like, these people you interact with every day. It's those small little pieces that then come together and impact what your life will look like in 40 years' time or something. And so it's so easy for it to just pass us by, isn't it? And if we don't have that determination to actually stop that there and notice, right, okay, these little pieces is what builds the big puzzle, then you can just carry on trucking through as you are. And that's how many chronic diseases arise, isn't it? It's small build-up of negative habits for your health. So I really like that point, but go with what you're going to say, Jake.
I was going to ask, you asked us why we want to live to 120. Can I ask you, like, do you want to live to 120? And if so, why?
Okay. I'm now at 38 years old. Yeah. And I've been a doctor for more than 10 years, actually. So if you ask me if I want to live until 120, to be very honest, and we know, I being a doctor working in the hospitals, we tend to see the final years of certain people's life, you know, and the final moments that they have. And to be honest, if you are sick, and it's not going to be nice for you to suffer through the last few days of your life, or even last few years or months of your life. And that struggle or the suffering can be quite torturing, to be honest. Me being a doctor, I've seen all of this in my life. So I would not want to live until 120 if I don't have the good health span. And more important is, I would love to live every single day to my fullest. And I don't care. To be honest, if you ask me, if you're going to die tomorrow, will you have any regret? I would say no. Every single day when I wake up, I tell myself, you know, I enjoy my life every single day. I do whatever I can that I think that's right. Be it helping people, be it making me, myself happy, or people around me happy. That's what I want. And by the time at the end of the day, I go to bed, I'll say, did I have a good day today? I did. I enjoyed my day. So that's all that matters. So to me, lifespan is not something that I really care about, but rather every single moment that you spend in this world, do you make a good memory out of it? That's all that I care about.
Yeah, I really like that. It's about depth of life rather than breadth of life. And I know that for the person that's not very accustomed with this like wellness space or biohacking space or this like anti-aging world, it might seem on the surface like that's what this space is trying to do, just extend the human lifespan by like any sort of biomedical forces that we can. And then I sort of, for me personally, I know I've heard other people, like my family, talk about this kind of stuff. Like, there seems to be an avoidance of death, an avoidance of mortality, an avoidance of that necessity that comes with being mortal. In that, like, I look at a guy like Brian Johnson. Obviously, I don't know him personally, and I do think he's doing good stuff to like push the field to its extreme. But I'm like, are you okay, bro? Like, why do you want to live for so long? Like, what are you afraid of, type thing? But obviously, you know, I say that with a bit of humor. But no, I like that. I like the idea that it's depth and not breadth. I think is really important for people to think about if they're going to look into this world, because I think you can also get, and I don't know if you would agree with me on this, but you can also get so obsessed with like these health metrics and things. Like, I know with my certain personality type, if I like started wearing like sleep quality like trackers, like a Whoop band or a ring with that ring on, I can't remember what the company's called now, but if I did that and I had numbers of how my sleep was, I know that would affect in a negative way the way I conducted my life. So yeah, it's a really nice point. I'd like to ask, this is just a personal interest of mine, and I think Jacob will relate, and I think people that listen to our podcast specifically, because the stuff we usually talk about, will relate to this. But I want to, like I mentioned earlier, focus specifically on the kind of mental and cognitive health span. I'd like to know, as you're an expert in this, what are the best practices that I can implement and people like me can implement now as a 20-year-old to maintain my ability to think, my ability to articulate through speech and to write and to sort of grapple with complicated ideas into my later life. And I don't know if that's in the diet world or in any specific exercise or sleep, or if there's any sort of particular compounds that I should supplement with or avoid. So tell me a little bit about this.
Okay. So a very good question. Thank you very much. So I would always see, if you want to maintain a good brain health, is to always focus on adequate sleep. Okay. There's no point of you taking a bunch of these psychedelics or all sort of supplements that are supposed to make your brain better when you don't have adequate sleep. So having a good sleep and good rest is the key to help you to remove brain inflammation. So we all know that yes, brain will age, and if the inflammation is added onto this brain aging, what will happen is you'll get demented way faster. Your cognitive health will definitely reduce, and there are a lot other mental disorders will kick in later on. So if you don't get a good sleep, the rest of it is just doesn't make sense anymore. The next is try to remove putting in toxins into your body. So try to avoid putting in any toxins into your body. So, for example, the commonest things that people do these days, alcohol. Yeah. So a lot of people would think that, okay, a glass of wine, a glass of beer doesn't hurt much. But I follow this Dr. Adam, and he is a well-known psychiatrist, and he studied about the human brain using SPECT scans. He did mention this. None of any alcohol is going to do good to our brain. So to me, yes, any sort of alcohol is considered toxins to the brain. Don't consume them, then you'll be able to preserve your brain better. On top of that, smoking, cigarette smokes, all kind of heavy metals, all these toxins that's around us. We are trying to prevent all these heavy metals, and also all sorts of toxins going into our brain and injure our brain. And one last thing, if you just want to choose one single supplement that's good for brain health, I'm going to say omega-3. A cheap one, but it is a fantastic option. I always tell all my patients, if I'm down to only a few things I can choose, omega-3 is going to be my priority. Because we all know that how much fish can we take in these days. If you're taking a lot of fish, fatty fish, we're concerned about mercury. So omega-3, a good quality, can provide us a good amount of good fat. And 60% of our brain is made up of fat. If you want to preserve your good brain health, you definitely need a great amount of omega-3 to support that.
Thank you. Yeah, that's a really nice answer. Some sort of things that I had a rough idea of, but other points that you really sort of consolidated, like it's so interesting, isn't it, that alcohol is such a big part of, like, especially, where we're from the UK, it's such a big part of our, like, social culture. It's just difficult that I think that we need to somehow use the evidence and the research and get that out into the average person's consciousness, because it's like poisoning yourself. I mean, there's so many better ways to have fun than poisoning your own brain.
To start with, like, for example, my partner, he's a person, when I first know him, he tend to drink a lot of wine. A bottle of wine is quite common. It's like after dinner, everyone is like talking, enjoying a glass of wine is pretty common. And then you just continue sipping and sipping without realizing you have already finished how many glasses of it. And this, in a short time, you won't see much difference. But in the long run, you will see a very big effect onto your cognitive health. Yes. So I managed to switch him. He's now pretty much not touching any alcohol, and he's okay with it. He doesn't feel like any part of his life is missing. So it's just a habit changing, knowing the importance of it. And when you change it, you actually feel better, you feel good, then you know that this change is all worth it.
I just want to really sort of emphasize this sleep point for myself personally, because it's something that I always struggle with in terms of, like, maintaining the rigidity of it, because life is so, like, for me, I'm an athlete, right? And I do a lot of my training in the evening time. And I have to do a lot of driving, so I'm getting in late, and then sometimes I have to be up for, like, uni lectures and things like that. Do you have any advice on, like, some real I don't know, stable like sleep hygiene principles that I can fully like dial in on, because I know about, you know, keeping your room cold, and I try and do that. I think one thing that I'm really bad for is like the screen, but like seeing a screen, you shouldn't see a screen like an hour before bed, right? But sometimes I'm the kind of guy where my mind is just whirring, but I need something to like listen to or to watch to fall asleep. So that's probably killing my like sleep quality and stuff. So do you have any advice for someone like me? Because I know there'll be so many other people out there that are in a similar situation of like some of the principles to improve our sleep quality, despite the fact that I can't really have a rigid schedule where I'm always in bed at 10 and always up at 7. Do you know what I mean?
Yep. So have you ever done any meditation?
Yes, I have. I was very consistent with it. I started in the COVID-19 lockdown, and I would do like 10, 20 minutes, sometimes 30-minute meditations every day. And I stuck to that for like 2 or 3 years. But then as like we moved away from that very nice time where we had so much more time to build these kind of habits and my life got more and more busy, it's one of those habits that just phased out, which I know isn't ideal. But anyway, carry on. This sounds interesting.
So pertaining to meditation, what I notice is people will think that, okay, in order to meditate, you need to find a time for it. You need to do it when you are ready. But to be honest, meditations is something that you can do at any single time. Okay, you don't have to find a specific place, a specific time to do it. So why I mentioned about meditation is you mentioned that you have a lot of things that's going in your mind. You kept thinking. So meditation is a good way where it will just ground you and quiet your mind immediately. And when you can do this, having this good practice, be it 5 or 10 minutes before you sleep, it will be very helpful to just quiet all the noises around you. And if somebody who have trouble doing it, like for example, I actually have got some rate of ADHD. I have trouble focusing. I get distracted very easily. And I used to think that, meditation is BS. You know, there's no way for me to do meditation. But I realized that there's certain thing, you know, I sort of like cheat during the exam. I get certain supplements that will help me to just calm myself down. Not something very difficult to get. Magnesium is one of it. So lemon balm is the other one, and passion flower. Those are considered herbs. And I use a blend of magnesium, lemon balm, and passion flower. It works fantastic for me. It quiet down my mind, and I just have to do a short while of meditation. I feel the peace. I can just go to bed easily. And I suppose this is something that can help most of the people like you, having a hectic schedule. You still have to train in the evening, and you have a lot of things in your mind. You can't control it. How can you quickly switch from the very active mind to a quiet mind with a little bit of help of all these herbs and supplements and meditations? It's going to work quite well for you. And sometimes you don't have to switch off everything when it comes to meditation. Meditation is about, you can do a mindful meditation, meaning that you focus on one single thing. Like you say, you can listen to certain things, certain music, certain stuff that will help you to just anchor your mind into one specific stuff. That will help, I suppose.
Well, I think that's why I've developed this habit where I listen to like a podcast to fall asleep, because people say like, how can you do that? Because your mind will be thinking about what they're discussing and you'll be active. But the way I see it is having something to think about stops me from like the rumination type of thinking about like my life and what happened at that training session or what I said to that person. And like, to me, that feels like a completely different internal process. So the one where I'm thinking about the one thing of the discussion going on in the conversation I'm listening to, I drop off to sleep much more easily. But then I can see that then in how you're talking about meditation before bed, because that will get me into that mode of thinking about one thing, whether it's my breath.
You've been doing it in a way.
Yeah, I guess I have, but in my sort of bad, modern, technologically like infiltrated way. But no, maybe that's something I should implement, because in my head, because of like my schedule and stuff, I get in from training, shower, like get ready for bed and just try and get to sleep straight away. But if I use that like 10 minutes to do a meditation sat in a chair outside of my bed, then I'll be in a different state to then fall asleep so much more quickly. So thank you for that. That's nice.